Hi, I'm Dr. Janet Pope, a Room Now reporter, and I'm reporting at EULAR 2021. I'm reporting on something that really is based in clinical questions. So I will have patients such as men with rheumatoid arthritis or other inflammatory arthritis who will say, will it affect my offspring if I'm on these various drugs? So there was a nice little study that was OP0211 looking at men with inflammatory arthritis by a survey over the age of 40 years. And they were comparing men who had had inflammatory arthritis and then had their at least one offspring, or men that had offspring before their inflammatory arthritis. So they surveyed 628 men. Now, what's kind of interesting is that we would expect the fertility might or might not be off in men who are taking these CSD-MARDs or advanced therapies. But fertility wasn't really the study of this one abstract. What they were looking at was the pregnancy outcomes of their offspring. So interestingly, there was slightly more miscarriages if the inflammatory arthritis occurred before the pregnancy. So in other words, if the men had inflammatory arthritis and then their partner had a child, there was a bit more miscarriages. But if you're astute, you might sort of look at data like this and say, well, if they had inflammatory arthritis and then had a family, maybe they're a bit older because they've already developed their inflammatory arthritis. And so the maternal age was a little bit older in the partners of the men who had had the inflammatory arthritis. So maybe the miscarriages were elevated because the women were slightly older. Now, the mean age being a bit older was only about 2 years, but it was statistically significant. And maybe it's the outliers on the age range that are driving the data. However, I don't know if it's a disease effect, inflammatory arthritis conditions affecting sperm or spermatogenesis, if it's a drug effect, or really if it's a maternal age effect, or none of the above. So I think we have to stay tuned and see more. Now, the other question is, if I have a woman, say with psoriasis, psoriatic arthritis, and she might ask, if my disease is active and I need to stay on my medications, what might be the serious infection rates for my baby? So there was a nice study that looked at this. It was over 16,000 babies born to more than 7,600 mothers with psoriatic arthritis or psoriasis, or 8,000 with inflammatory bowel disease. And this was data from a large comprehensive market scan database. What they were looking at was comparing TNF inhibitors, where we have a lot of data already, and also ustekinumab and vedolizumab. Obviously, the latter drug is used in inflammatory bowel disease. And what they found was that although ustekinumab had a slightly higher serious infection rate in the offspring, all the rates were low. None of them were statistically different, and they also were about the same rate statistically and numerically as mothers on no treatment with psoriatic arthritis, psoriasis, or inflammatory or bowel disease, no treatment during the pregnancy, or mothers on conventional synthetic DMARDs with these conditions during the pregnancy. So I would probably tell the mother asking me was that it's important we control your disease activity during pregnancy. If you need to take a certain medication to control your disease, you can, and that the serious infection rate should be no different than other moms with your diagnoses. So follow us at Room Now and enjoy your day. Thank you.